Good evening. This is Mayor Baraka. Thank you for tuning in once again to our nightly COVID-19 updates. Uh, Excuse my attire. I know there have been comments about me doing this at home. I know folks want me to do it in the studio with the flags and all the other kind of things going on. Excuse my attire. I have on my always a Phoenix, graduated from University High School, so have my gear on and I'm trying to stay safe. So I'm going to continue to do it here as well. Before we begin, I just want you to remember yesterday began the time when you really needed to begin filling out the census, April 1st. If you have not filled it out, please do so. You can visit the census website at www.2020census.org, 2020 census.org, .gov. Need everybody to go there. Also, if you want to call, you can call 800 toll-free numbers. These numbers are directed towards your language, whatever language you speak. You can call that number and they'll be able to, respond to you in the language that you speak. There's one for Spanish, French, Haitian Creole, Portuguese, probably one for almost every language available. They'll be listed on our Facebook Live. They'll be listed on our Facebook page right after this, so you can get it on the page right after this. But please, we need you to fill out the census, www.2020census.gov, www.2020census.gov, if you have not already done so. We also announced a couple of initiatives today that I think you should be aware of. One, we announced the Arts Fund for artists and arts organizations that are struggling because of the COVID-19 pandemic. You can get information at info at Newark Arts, or you can go to our website, and we have the information on our website. Let me get you the exact website for that. That's info at newarkarts.org, info at newarkarts.org. Make sure in the comments you put Creative Catalyst Fund, info at newarkarts.org to find out more information about the Artist Fund for arts organizations, arts collectives that were affected by COVID-19. We also announced money for homeowners who, or folks that are trying to own homes that were in the process to get these homes but were also affected by COVID-19. We have money available for you as well, also on our website. We also had a small business webinar today. If you missed it at 2 p.m., a small business webinar at 2 p.m. If you need information about the webinar, you should go to website www.investnewark. That's www.investnewark.org, www.investnewark.org to get information about that webinar. If you are a small business and you have the information and you're just trying to get resources because your business closed, you should go to www.uwnewark.org, www.uwnewark.org, and fill out an application for small business fund that we have put together, grants for up to $10,000 for small businesses. Those are businesses with 10 employees or less, or sole proprietorships, organizations or businesses in the city that were affected also by COVID-19 and our lockdown procedures. We have limited funds, so you need to go to those places immediately. You also should pay attention to the state and federal funding sources that are also available for small businesses, as well as sole proprietorships, as well as nonprofits, as well as individuals who are collecting Social Security, unemployment, who have been laid off. There's all kinds of programs that are now been put in place because of the stimulus package that has in fact been voted on. So let's get to the numbers. Today in the United States, we have 8,861 people who have recovered. 8,861 people who have, in fact, recovered in the United States as a whole. So there are almost 9,000 people who have recovered from COVID-19 who struggled and fought through this. So that's a good thing, and those are some positive results. But on the other side, we still have 226,374 positive cases in the United States. That's 226,374 positive cases in the United States with 5,316 deaths. 5,316 deaths. In Newark, we have 785 positive cases. 785 positive cases in Newark with 21 deaths, still 21 deaths yesterday, still at 21 deaths today. The positive toll obviously went up from yesterday to today, and it is still alarming. In the state, that we have 25,590 confirmed cases in the state, 25,590 confirmed cases in the state, and 537 deaths. 537 deaths. Most of the places in New Jersey, the places in New Jersey that are the most alarming, obviously, are Bergen County and Essex County. Our proximity to New York City probably has a little bit to do with that. Jersey City, Newark, Fort Lee, places like that are having difficult times. So I just want to break down some of the numbers in Newark. There are about 389 females based on the breakdown we have. This is not all the numbers, but this is almost all of the numbers. So 389 of those cases that we have are females, right? 355 are males. So there is no significant difference between male and female, no real significant difference between male and female. And as you know, earlier we were identifying hot spots in the city. We tried to do that, but at that point in time, I do not think that we were able to stop people from moving back and forth from place to place. We locked the entire city down. Right now in the West Ward, we have close to 170 cases in the West Ward, a little over 170 cases in the West Ward. And North Ward, close to 160 cases in the West Ward, in the North Ward, close to 160 cases in the North Ward. South Ward, about 145 cases in the South Ward, about 145 cases in the South Ward. In the Central Ward, about 141 cases in the Central Ward. And in the East Ward, 97. East Ward is about 97 cases. So for the most part, it is divided very closely throughout the wards of the city. So it doesn't matter where you are, where you live in the city, it is infiltrated the part of the city that you, in fact, live in. And so that's tomorrow. We'll have the information broken down for you by ages. We'll also have Dr. Elmer Hall on from University Hospital. We'll have Dr. Wade from the Health Department. We'll have Director Ambrose from Public Safety on the line. We'll all be on the line talking from our perspective around these issues. Dr. Elmer Hall will talk to you about the fact that all of the ICU beds are in fact filled at University Hospital because it's a trauma center. When the state is in trouble, they reach out and expect Newark to step up. So most of the beds, the ICU beds are taken, the ventilators are taken. We need more beds, we need more space. That's why it's very, very important for people to stay away from folks so they in fact don't get sick and overrun our hospitals. We've identified 2 locations that we're going to begin on Monday, moving many of our homeless folks in that have in fact tested positive for COVID-19, because they are homeless individuals that have in fact tested positive for COVID-19. We've gotten them off the street, we've tested them. Many of them are in the hospital. We're trying to move them to a location on Monday. We'll also be moving some of our senior citizens out of some of these sites into places as well, and other folks, at the same time. to be able to isolate the growth of this virus. We've identified a place in the city to help the hospitals when they have no more space for folks to come into the hospital, to pull some of the folks that do not have COVID-19 out and put them in a location to provide as a hospital outside of the hospital so they can make more room for COVID-19 patients. We've identified that space in the city, along with what the state is doing around FEMA. They have located, they're using the Meadowlands, beginning to open and use the Meadowlands to have extra beds for the folks in the hospital as well. We have distributed thousands of meals of food, and we're going to continue to do that. We just need more resources. We are on pause for a couple of days trying to gather our resources. So if you're calling, bear with us. We're trying to get our resources together to put more money on these food cards so we can begin to deliver the food cards again to the people in the city who need them. Obviously, if you're somebody who has access to resources, please, you can go to United Way of Essex and to the COVID-19 relief site fund and put money in there to allow us to extend our food distribution. I spoke already about our small business program that we have. Later on, we will be dealing with hourly wage workers and relief for people who are rent challenged due to the layoffs and closure of businesses around COVID-19. Stay on the lookout for that. We will have something available very, very, very shortly. I do want to say thank you to Congressman Payne, and you get a chance to thank Congressman Payne. He has been working to make sure that the city of Newark gets additional dollars from the federal government, get additional dollars from the federal government that come right to the city, because the stimulus package, the way it's written now, cities less than 500,000 people do not get direct funding, right? The direct funding goes to the states or the county. We need some money to come directly to the city. I want to thank Congressman Payne, his colleagues in the House that are helping to try to fight for us, particularly the Correctional Black Caucus and those associated with that are fighting to help us get money directly to cities that are below 500,000. In fact, there's no city in New Jersey that has 500,000 or more residents in it. So, Congressman Payne, thank you for the work that you're doing. So we need to thank him, but we also need to reach out to our Senate delegation, Senator Booker, Senator Menendez. We want to reach out to our congressional delegation, whoever your congressional delegates are, and begin talking to them about the fact that the hospitals, we need ventilators, right? We need masks, we need protective gear at our hospitals, right? We need all of these things to help us, and we need testing. We need testing. We need the test kits, the ones that take 5 minutes, the ones that take 45 minutes. Many of our testing sites in New Jersey, it takes anywhere from 5 to 6 days for you to get the test results back. But the one in Weekway Park, the drive-through test is probably the shortest time period. Usually takes them 24 hours, no more than 48 hours to give you your test results back. Anything other than that has been taking people anywhere between 5 to 7 days. We need the 45-minute test, the 5-minute test here in New Jersey. Speak to our governor, speak to our federal delegation, help us get the resources we need to get those tests right here in our city so we can begin testing more and more people, because the more people we test, the more we have our eyes on what's going on and more we have an understanding of who in fact has cases and who not, and we know how to move, how to isolate people, how to make sure other people are not getting it, and helps us make decisions about lockdown, about anything else that we have decided to do in the city of Newark. So please, we also need the president to use his authority and his power. So let me tell you the problem with equipment. So for example, if the CDC or the president of the United States says that everybody should be wearing masks. In fact, when I finish this call, I'm going to make another edict about Newark and covering your face and mouth when you go outside. But when the governor or the president and the CDC says you need masks, and they do not authorize or regulate companies to make a mask, to make the specific mask, purchase the mask and give them out, distribute them to the states, what happens is all of these private companies begin making masks and competing and charging prices that are ridiculous. So you'll have masks that were once 75 cents are now $20. So you have states competing for this, and you have scam artists and all kind of folks selling you things from masks to ventilators to outfits for nurses, gloves that they all put out there on the free market. Some of them are fake, some of them are not real. You know how that works, right? In this market system, since we don't have a centralized economy. But during this time, in an emergency time, the president has the authority to centralize the economy. He has the authority to force companies to make these products and begin to distribute these products throughout the country. We need that, right? And we need it now because we're running out of resources, not just in New Jersey, but all over the country. If you can, if you have free time, if you're home, call your congressman, call your senator, call the information, the Intergovernmental Affairs Office in the White House. Begin to voice your concern about some of these issues so that the president can make a decision. We also need the president to make a uniform decision about lockdown and curfew all over the country. There are many different types of curfew, even in New Jersey itself. So I was going back and forth with an individual saying that why is it only the Black and brown communities that have these curfews and this, he said, over policing. Well, that's not true. More than 80% of the country is under a stay-at-home rule. They're under a stay-at-home rule and should only be coming out for emergency purposes. And we're not as strict as countries like Italy. In Italy, obviously has a worse problem than we have here in the United States. But our problem is in terms of the deaths, but our problem is getting there. We have more cases. Our problem is getting there. We become the epicenter here, the United States, in the world in terms of the number of cases that are being identified. So we have to lock this down. It's not about your nationality, your language, your race, your color, your neighborhood, where you live at, your class stance, whether you're poor or rich. Anybody can get COVID-19, and that's it. It is a silent a kind of perpetrator, and it comes in everybody's home, which is important why we must lock everything down as quickly as possible. There's only really two ways to get your eyes on this, folks. Either A, you test everybody that you possibly can, and because, as I said earlier, we don't have the test to test everybody, we have people walking around that are in fact infecting people who do not know that they in fact have the virus. Either that or you quarantine as many people as you can in a very strict way to make sure they're not passing the disease or the virus around from person to person, to slow it down, to flatten the curve, to give the doctors and the healthcare system a little bit more time to respond in the way that they need to respond. And since we don't have tests, we have to do what we can to flatten the curve, which means that you cannot be piled up in groups. You cannot be piled up in stores. You have to practice social distancing. And places that are not doing that, we are in fact going to close them down, whether they're liquor stores or warehouses or corner stores. There were a few corner stores we went to that were left open that we closed down. We've closed down dozens of corner stores since we started our lockdown. We've closed down maybe a half a dozen liquor stores. We've approached warehouses who have not provided the proper protection or social distancing for their employees, and those that didn't do it, we told them if they didn't do it by a certain date that they would in fact be forced to close, and most of them have complied already, and we're still out there trying to get others. If you know businesses that are trying to dupe us or trick us to stay open, please let us know. You can call 973-733-6000 or 973-733-4311 or at me on Instagram, and me or somebody will check that and get back to you, or go directly to the location to be able to check those folks out and make sure they're doing what they're supposed to do. All these businesses that are allowed to open should be social distancing. They should not be allowing a bunch of people in the store at the same time. If they are in fact doing that, they will be shut down. So we are continuing this. Newark, East Orange, Irvington, we're continuing our lockdown. There are many cars that have been turned back There are people that have been pulled over. There's streets that are blocked off in the city of Newark. That is all a part of what we're trying to do to make our residents safe in our community. Lastly, there are, on this note, there are a lot of folks that are, coming up with reasons, on the internet that I argue with, or I should say that I have conversation with, a debate with, that I'm going to stop debating with actually, because, it's not the time for debate, it's really the time for action. So at this point, you can tell me that you saw Sanjay Gupta on, on Contagion, or you think it's a conspiracy, or the 5G is doing this, or I'm getting all kind of plethora of back and forths with people about all of these things, about the Illuminati and all of this stuff. And the reason why I'm mentioning this is because some of these people have huge followings and people listen to this stuff. So here's what I want to say to you and the people that are following you. Listen, like after this is over, we could even have a virtual discussion about it if you like. But after this is, I would prefer to do it when it is over. After this is over, because it will be, we can have a discussion. Let's get Rutgers or NJ Pack or something to have a discussion about COVID-19 and viruses and things that happen in our community. And I know historically there's reason for people to have doubt and suspicion. Look, this is the same place where they put smallpox in blankets for Indians, where in the Tuskegee experiment, they gave people syphilis on purpose, right? So I understand the history of where it's coming from, but right now is not the time for that debate. Right now, we should be trying to save as many lives as possible, getting people in their homes, get them to practice social distancing, making sure that our elders are safe, that our children are safe, making sure that we're following all the instructions and the people under our care are protected, and the stores that are servicing us and are servicing us properly, and that all of the people that are out here working that have to work because they're essential employees are in fact protected while they're out there doing the work that they're doing. I have to save lives. That's my job, and I'm imploring you to help me do my job by helping me to save lives. Get kids off the street, get adults in the house, do what's necessary to put the word out. And once that happens, and once we survive this and get over it by the grace of God, we can have a huge debate about where this came from, the origin of it, who started it, what it was about, Bill Gates, or whatever it is that y'all want to talk about. We can do that. And I don't, most people are putting that on their own, but when you start atting me and going in my inbox telling me about it, then, it's my fault for engaging you. But at the end of the day, we need to be talking about saving people's lives. Going to our seniors, don't forget, tomorrow at 11 o'clock, there is a senior meeting, a phone meeting at 11 o'clock with your superintendent. Superintendent Leon is having a meeting at 11 o'clock for all seniors. Parents, if your senior you have a senior, they don't know that, make sure they get on that call at 11 o'clock. Your school should have contacted you and given you the information about the call, but you should get on the call and listen to what's going on. That way, I think it's some good news, some informative stuff for you, so you know how to proceed going forward with graduation, with requirements, with all of the things that you need. And the superintendent is doing an awesome job. Shout out to the administration there and the school system and the faculty and the staff and the principals and the workers there that are doing their job to make sure the schools stay open, right? Because there's things that we have to continue to do. We have to still collect the garbage. Last night we had 3 water main breaks. That means pipes busted and water was coming out of it. Water was shut off in communities. Our workers had to go out from 3 a.m. all the way to 10 this morning fixing water mains so that people can have water. So we still working, and we still have to fix those things. There's still people being born. So vital statistics are still there. There's still people who have to get WIC. WIC office is open. It might not be open on the regular hours, but you should call over to the WIC office and make sure the folks are still working. They're still making sure you get WIC, and they've mailed out many of those checks. So some people should have got enough resources for at least 30 days or more based on the WIC checks that was sent to you. So we're still working here, and we're doing what we can to provide services. Garbage is still being picked up. All these things are necessity, and we're going to continue to do that because the city is still functioning. Just want to, before I close, shout out a couple of people who I asked to do the online. I asked us to do hashtag Newark Strong to show what you and your family are doing in quarantine, to show you what Newark Strong looks like. And there were a lot of creative and incredible things that I got from the residents of the city. Plus, I got a couple of raps and poems from folks that are out there too. Loved them. They were great. Just want to shout a couple of y'all out. Buff Puff 32. Thank you, your family and the card game and the thing you guys were doing. Appreciate that. Nas 2X. Great lyrics, brother. Noted by Monty. Thank you. Indio Champ. The story that you have, go check out Indio Champ's life story, the video that he has on his page. Incredible brother from Liberia, fleeing the war, came here, got in the streets and turned his life around. Check that out. I want to shout out Neighborhood White Mike for his support and always putting up positive messages. Keisha 09, young girl on there, very vibrant, very exciting, very encouraging. Keisha 09, Finesse Kid, thank you. Thank you for what you put up there. Anisha Pictures 1 2 3 4. Anisha Pics PICS 1 2 3 4. Thank you. I am J Skills. Excuse me. I am J Skills. Thank you. C4XX. C4XX. Jazzy Cat 83. Jazzy Cat 83. Style Maven. Thank you as well. Always support from you. Always positive messages. Coming from you as well. Those are the ones that I have today. There are many more. I'm going to give those folks shout outs and other people. What I want you to do is post something that you're doing with your family during this time and hashtag Newark Strong, hashtag Newark Strong. And I'll post them and give you a shout out, particularly the ones that I think are great, incredible, inspiring, encouraging, trying to help us get through what is a very difficult time for us in our households. And I appreciate that for sure. So continue to put those up there. Again, tell all you guys out there, hold the line, take care of your families, take care of your communities, check on one another while you're out there. Let's be the men in our community and begin to do what we're supposed to do in our neighborhoods, in our households, in our streets, in our blocks, to make sure we're doing the right thing out here, y'all. So holding the line is what we should be doing. So hold the line, brothers. Stay tuned for a virtual men's meeting that's coming up as well. You'll see that on my page and other people's pages. We're going to have our men's meeting virtual style. So pay attention to that as well. Lastly, thank everybody, man, for all the work you're doing and all the families that are toughing it out, staying in the house, paying attention to the curfew. Somebody asked me today, do we need the National Guard to help us bring these people in the house? First, I don't have the authority to call in the National Guard. I can ask the governor to do that, but at this point, we don't need that. I think that the majority of the families are holding it down and holding the line. They're staying in the house. They're practicing social distancing. They're doing what they're supposed to do. For the most part, there are a few people who are not, and we're going to continue to push and get them to do what they're supposed to do. We can control our own community. We can take care of our own self. We can police our own community. We know how to take care of ourselves here. We can follow rules. We can follow instructions. We can save our own lives. Why? Because Newark is strong. Now, part of the edict that I said that I was going to add before I got off of this was, when people come outside, if you're going to the supermarket or going to the pharmacy or walking your dog where you have an emergency, because those are the only reasons that you should be coming outside. Going to the pharmacy, going to the doctor, going to the supermarket, or walking your dog, or you're an essential employee. Those are the only reasons you should be coming outside, right? So if those are one of the reasons and you're outside, we're asking you to cover your mouth and nose. Have a mask or something else. Now, I know earlier people told you it might not be healthy if you wear a mask. Some people don't have it. So if everybody wore a mask when they were outside, we have to worry about people coughing or sneezing on you, because all of them will have a mask. We're going to be paying attention to that. And we want you to first, on your honor system, when you walk out of the house, if you go into the store, to wear a mask. Wear a mask, right? Put one on. And if everybody has it on, we don't have to worry about anybody. You put on your mask, you cover your face, cover your nose and mouth as you walk around, right? Wipe off surfaces and substances while you're out there as well. Protect yourself, protect your family, while you're outside. We're going to be asking people that we see without masks, without covering. We're going to ask you to cover your face. We're going to ask you to go back inside and get a mask. We need you to do that as a part of our next effort to make sure that all of us are in fact safe and secure. God bless all of y'all. Godspeed. Tomorrow we're going to have about 4 or 5 of us on, and we're going to be dealing with multitudes of questions that we got ahead of time from folks regarding what's going on with the COVID-19 virus. Hopefully I address many of the concerns that people had. Have an incredible, incredible evening. And thank God each day you wake up and take a breath. Godspeed.